Data analytics in healthcare. In healthcare, decisions often have life-altering outcomes both for patients and the population. The ability to quickly gather and analyze complete, accurate data enables decision-makers to choose treatment or surgery, predict the path of large-scale health events, and plan long-term. In their career, nephrologists may treat hundreds to thousands of patients with end-stage renal disease. A medical team has collected data on over 1 million end-stage renal disease patients. They have data from every treatment, every lab, every medication and assessment, resulting in over 4 petabytes of data. That's over 1 million gigabytes of de-identified secured patient data. Imagine that they wanted to find the data from a historical patient who most closely matches the patient currently sitting in the dialysis clinic to inform the best precise personalized treatment. The amount of data at this hospital is too large for any clinician, nurse, dietitian, social worker, or technician to search. That is where healthcare analytics can help. Data analytics can provide a foundation for sound, impactful decision-making. What is data analytics? Data analytics is the process of interpreting quantitative data to reveal qualitative insights, answer questions, and identify trends. One can analyze data manually or with the help of software and algorithms. Visualizing data by creating graphs and charts can help present data and information and show trends. Healthcare analytics involves applying mathematical tools to large amounts of data to inform decisions that help improve care for every patient. There are 4 key types or levels of data analytics. Descriptive analytics examines and describes something that's already happened. For example, descriptive analytics determine how contagious a virus is by examining the rate of positive tests in a specific population over time. Descriptive analytics allows us to answer questions such as, how many patients were hospitalized last week? What % of patients dropped home therapy in the last month? What are the average XI laboratory values for the patient population? Investigators can answer such questions by looking at historical data and using simple statistical measures such as counts, percentages, averages, and standard deviation. Then, they can track these measures over time to see if a practice meets its goals. Diagnostic analytics seeks to understand the cause of an event. For example, diagnostic analytics diagnose a patient with a particular illness or injury based on the symptoms they're experiencing. Diagnostic analytics allows us to answer questions such as, why did these patients go to the hospital last week? Why did patients leave home therapy? Why do patients not meet lab value targets? These questions allow us to dig into the data more, usually to understand or explain the answers found in descriptive analytics. For example, if we are trying to grow our home therapy program, we may discover from descriptive analytics that 10% of the population drops each month. The next logical question is why these patients dropped. In diagnostic analytics, we investigate the discharge reasons and measure the distribution of categories such as peritonitis, partner burnout, psychosocial issues, etc., by using statistical techniques to understand those reasons. As in descriptive analytics, diagnostic analytics involves an investigation of historical data. Predictive analytics explores historical data, past trends, and assumptions to answer questions about the future. For example, predictive analytics forecast the spread of a seasonal disease by examining case data from previous years. Predictive analytics allows us to understand what will happen, creating predictions such as, which patients will have the highest risk of hospitalization next week? Which patients are likely to switch from home therapy to in-center next month? Next month's BMM values for each patient. In predictive analytics, data scientists use historical data to train models to predict future events by employing advanced computational techniques, such as machine learning. These models can take advantage of thousands of data elements in the electronic record for each patient and identify patterns from all patients in the database. Using predictive models, investigators can calculate risk scores for each patient and determine which patients may need additional attention. However, predictive analytics does not indicate how to prevent adverse events such as hospitalization. Prescriptive analytics identifies specific actions an individual or organization can take to reach future outcomes or goals. For example, prescriptive analytics assess a patient's pre-existing conditions, determine their risk for developing future conditions, and implement specific preventative treatment plans with that risk in mind. Prescriptive analytics allows us to determine what actions are needed to change the prediction, as in the following examples. An extra treatment may help prevent the predicted admission for this patient. A home visit may help prevent home therapy discharge for this patient. A different therapy may help this patient with medication adherence issues. Investigators can dig into predictive analytics to understand the factors that drive each model. By determining which factors can be changed to lower the score, they can start to create prescriptive interventions that will lead to better outcomes. Prescriptive analytics is the most advanced healthcare analytics because it allows for making specific recommendations on patient care delivery interventions. Prescriptive analytics may concern the clinical community because a machine is making medical decisions. However, healthcare analytics, specifically predictive modeling, is just a tool that clinical staff can use to improve efficiency and efficacy. In fact, studies show that the combination of human and machine works better than either one by itself. Data analytics can have far-reaching effects on the healthcare industry. Here are 3 examples to consider. First, evaluating and developing practitioners. Data gathered from patients regarding their experiences with medical practitioners can be analyzed to reveal areas for improvement. One example is research on empathy in physicians. After noticing that doctors often prioritized objective and scientific facts over a patient's experience of their symptoms during appointments, the researcher conducted a study in which patients rated their doctors on how empathetic they perceived them to be during visits. After gathering the data, half of the doctors received empathy training, while the other half did not. The doctors were again rated, and the group that received training was rated as more empathetic than the control group. By analyzing patient-reported data, the researcher discovered that training could increase physicians' empathy, which has been associated with greater patient safety and fewer malpractice claims. Second, detecting anomalies in scans. Machine learning algorithms can analyze data more quickly and efficiently than humans. For example, in 2018, researchers created an algorithm that detects differences between 3D medical images, such as MRI scans. Because of the algorithm's ability to learn based on previous data, it can identify discrepancies in scans more than 1,000 times faster than a human doctor. The Harvard data science professor warns against relying too heavily on algorithms. Without human thought and guidance throughout the entire process, none of these seemingly fantastical machine learning applications would be possible. When paired with a human practitioner's critical thinking and knowledge, machine learning algorithms could potentially save both time and lives. Third, predicting outbreaks. Data analytics can also predict trends in the spread of illness, allowing doctors' offices, hospitals, schools, and individuals to prepare adequately. For example, the Centers for Disease Control and Prevention (CDC) leverages data to predict the next flu outbreak. The CDC has collected data about reported flu cases from participating doctors' offices and hospitals for over a decade. Using that data to help forecast the severity of future flu seasons can help make decisions. This is an example of predictive and prescriptive analytics because the CDC uses historical and current data to predict trends and drive action. Similar to the flu example is the coronavirus pandemic. Analyzing data to predict future spikes in cases can help hospitals ensure staff has enough personal protective equipment and patient beds. It can also enable school administrators to decide whether in-person learning is a safe option and individuals to make sound choices regarding personal safety and hygiene, social distancing, and travel. Potential pitfalls to avoid. While data analytics has the power to drive positive change, it can create and perpetuate issues. Therefore, personally identifiable information must be protected when handling patient data. It's also important to catch and correct biases in algorithms when analyzing data. Because people write algorithms, they often display human bias. For example, with race, gender, sexuality, socioeconomic status, and geographic factors contributing to unequal healthcare access, algorithms meant to draw conclusions about the population as a whole may not receive data from certain minority groups and generate inaccurate and potentially dangerous conclusions. Machine learning algorithms learn based on the provided data, so ensure that the data comes from a representative sample of various demographics before drawing conclusions.